Hello and welcome. Thank you for considering the Cleveland Clinic Fellowship in Consult-Liaison Psychiatry. I'm Anna Shapiro-Crew, one of the current fellows, and I have the privilege today of interviewing our two past fellowship alumna, Erin and Sam. Welcome, ladies.
Hello. Thanks for having us.
Ladies, let me ask you, how was the fellowship?
Fellowship was more wonderful than I could have imagined for several reasons. One being I did my psychiatry training here as a resident, and that's when I really fell in love with CL as a second year during our core rotations. And being able to train even further with the faculty that kind of helped me learn my passion for CL, being able to train in such a learning from a robust patient population, working with so many different teams, learning so much from different colleagues. I wanted that opportunity more than I could say, and it's been a wonderful year and really helped me to grow as not only personally but also professionally.
Yeah, and I would say, as we've been wrapping up the year and people ask me how is fellowship, and the word that always comes to mind is fun. I've had a lot of fun this year. The quality of the consults at the Cleveland Clinic are outstanding, so it's been challenging, exciting. It's been a lot of fun working with the faculty here, co-fellow, the rising fellows, and getting to find my feet as a future attending here. I think it's a really excellent opportunity to sort of figure yourself out in terms of what you're going to be doing as an attending, and I think that being at the Cleveland Clinic gives you the opportunity in fellowship to definitely not be a resident anymore and enjoy that time as a fellow where you're making most of the decisions and you're really managing your patients more or less as an attending for most of the year, but with the protection sort of always having someone who's got your back to just double check for that added layer of confidence that you're going to build during the fellowship prior to becoming staff at another institution or staying here.
So what are your future plans and how did the fellowship help you achieve them?
As far as my future plans, I will actually be staying here at the Cleveland Clinic, and I'll be working with the transplant psychiatry team. And the fellowship definitely helped in that. I was able to work with Dr. Kathy Kaufman and the transplant psychiatry team, our nurse practitioner Joe Lander, and really developed my love for that patient population. I got exposure to that patient population. I was able to work with our team, who was just phenomenal. And I think that working at the Cleveland Clinic really not only allowed me the exposure to even identify that this was a passion of mine, but also to get experience in it before moving on to the staff position. And even outside of the transplant population, so many of the patients we receive consults for are very medically complex. So you see a lot of different pathologies, you see a lot of different patient populations, which I think no matter what field you're going to be going into or what position is going to help you not only in your psychiatry knowledge, but also just your general medical knowledge to be able to take care of very ill patients and be able to do that confidently.
And I am happy to say that I will be joining the faculty at the University of Pennsylvania. I'll be doing primarily inpatient psychiatry consults on the teaching service. And I will also have some time in a clinic that targets pregnant women who are struggling with opioid use disorder to provide maintenance treatment for them in a medical home model where OB-GYN, psychiatry, and other social services can all be in one place. And I would say that as someone who did a fair number of interviews to find out what was going to be the right fit for me. Definitely having come from the Cleveland Clinic was a major boost to the degree that, honestly, when I went for my interview at the University of Pennsylvania, they were more or less ready to hire me based on my CV alone. And coming from a fellowship program like this was a big component of that, knowing that I had gotten an excellent education and a lot of exposure to very difficult cases as a way to prepare me to transition into that role. And so I think that, in terms of my clinic that I'll be doing, you certainly have a lot of patients with opioid use disorder here, but in general, I think going on interviews, everyone that you're going to be speaking with already knows that you've gotten a great foundation for doing consult work, and they are ready to put you at the front lines as, an attending, even if you were a fellow just a couple days ago.
Well, that sounds wonderful. Those are all of my questions. Back to you, Andrew.
Hi, I'm Andrew Coulter. I'm one of the current CL Fellows. To continue, what stands out as a big thing in your fellowship experience, guys?
Sam mentioned this earlier, but one thing that stood out to me was just having a lot of fun this year. Despite having challenging cases, despite sometimes having a busy schedule, the busyness was always fun. I never felt like I was working. I always felt like I was learning. I always felt like I was able to soak up every opportunity that came my way. And that's really the main thing that stands out for me, is just having a lot of fun this year, which was, not something that some people consider to be work is fun, but I did. I had a lot of fun. Another thing that stands out for me is just really feeling that the faculty here trusted me. And that was really important. I felt like I had a lot of autonomy for seeing patients, and although I felt very supported by the faculty here, I felt like they always were available to me. I felt like I could ask them questions or have them see patients with me if there was a concern. They trusted me, and that was really important to me and really helped me shape my confidence as a professional now going to be an attending.
And I think that some of the things that stood out for me, to not duplicate what she just said, would also say I really appreciated being able to go to different clinical sites and learn what it's like to do consults at different types of hospitals. So here at main campus, it's a 1,200 bed facility, and the sorts of consults that you get and the way you interact with teams, it's going to be very different from if you go on to choose in your career to do practice in a very different setting. So I think it's a great benefit to us that we also get to do rotations at a couple regional hospitals, and that you're also rotating through different outpatient clinics throughout the year so that you can see what it's like to be a CL psychiatrist in an outpatient setting, and have that exposure so that regardless of what setting that you go to practice in, you've been prepared by this program. And most of the rotations are here at main campus, and having the individual sites and then the option for the electives at the end of the year helps you kind of hone your interest in what sort of setting you see yourself in the future.
And it sounds like there have been a lot of beneficial aspects to the year. What are the biggest challenges that stand out to you that you guys have faced and overcome?
Well, I think one of the biggest challenges we were tasked with was CL psychiatry in the era of COVID, which I know was not something unique to us. I know people all around the country and all around the world were dealing with this. And something that happened here at the Cleveland Clinic was when we were really trying to determine whether or not physicians would need to be redeployed to help other areas of the enterprise. We were actually all fellows, not only just in psychiatry, but across the enterprise were given staff privileges to be able to help if needed. And we were able to really utilize that and acted as staff at times, always still having the availability of attendings to be there for us if we had questions or concerns. And although that was a challenge and something that I was not expecting in March, 3 years before my fellowship ended, to be told, your staff, you can see patients on your own now. Despite it being a great challenge, it also, I think I ended up feeling I gained so much confidence in having that experience and really feeling now even more confident in my abilities to see patients independently, to make clinical decisions. So although it was a great challenge, I think that there was great strength that came from that.
I would definitely agree with you, Erin. I think that of all the challenges that we faced this year, it would be difficult to say that anything was harder than learning to practice CL psychiatry during COVID times. And I think that one of the high points of that was, despite everything that was going on, seeing the way that everybody pulled together. And so me, Erin, all of the faculty were volunteering practically for redeployment and saying, whatever you need done, let's just do it, signing up to take anything that needed to be done, because we did have to move people around from different sites a bit. And I think seeing how everyone in our division completely stepped up to that challenge, and it was more Dr. Pazuello reminding people, no, your vacation is scheduled, take your vacation. And nobody wanted to take vacation. Everybody wanted to be here supporting each other. And it was a challenging time, but it was really a time where you saw the best in everybody, and you could see that there was nobody that didn't want to jump up and down and face that challenge and say, we got this and we can do this, and work together on that.
really incredible stuff and really incredible work that you both did. Our last question is, how do you guys find living in Cleveland?
Oh, that's easy. I love Cleveland. I'm biased in some degree because I'm from Northeast Ohio, not Cleveland specifically, but grew up making trips to and from Cleveland, and I really feel like the city has so much to offer. It has the qualities of a big city, but it's not a big city. It's more manageable as far as getting around, finding where you are in navigation. And I really feel like Cleveland has something to offer to anybody, whether your interests are food, or music, or arts. I mean, we have great sports as well. And some of the best metro parks, I think, in the whole country. So I think that, it's not only wonderful to be able to train at such a wonderful institution and be in this environment, but also to be able to leave work and be in such a wonderful city with so much to offer just is like the cherry on top for me.
Absolutely. I too am a little biased. I did medical school in Cleveland at Case Western Reserve, so I had an inside scoop that Cleveland really is a fantastic place to live, and was eager to move back. Love the orchestra, we love the art museum. You have beaches in Cleveland, you can go to the lake a lot. I love the baseball. I might question when you say that all teams are great teams.
I have to say optimistic, right?
But I chose to live in Asiatown, which is about 10 minutes away. And it's a very central location and excellent restaurants. I love living here. And part of the sadness of leaving Cleveland is leaving during COVID when a lot of things have now been open and a lot of things got canceled. So it's not just the sadness of leaving the program and leaving colleagues, but it's also Cleveland that we're leaving behind with, it feels like a lot of unfinished business of a lot of things that I wanted to do and see and experience, because there is so much to do and see and experience, leaving that, without that satisfaction of doing everything I hoped to. But I really love living here. And I will say, for those of you that are snowphobic, it did not snow like hardly at all this winter. We had a fantastic winter. I think it snowed more in the south than it did in Cleveland.
And I would say a very family-friendly city as well. And I think that, if you have a family, I think that you'll find many different things to be able to do with your family while you're here. And I think especially the Cleveland Clinic and the program itself is also very family-friendly. So if that's something that is important to you, I feel like we will be able to, meet your needs in that aspect as well.
Absolutely. And I would reiterate what Erin said about this being, the benefits of a city without the congestion. Within Cleveland itself, there's not rush hour. It's very regional. So when people refer to living in Cleveland, a lot of it will mean the area around Cleveland. And I will definitely miss having the benefit of a very populated city where you can have major league sports teams and an orchestra, one of the best art museums in the country. But then you go just 10, 15, 20 minutes outside and you have all the benefits of suburban living, which is extremely convenient, very easy to access everything that you need. Part of me is going to miss that, going to a big city where you can't just park on the street casually.
Well, Erin, Sam, thank you guys for your time, and thank you for all of the great clinical work, teaching, and mentoring you guys did for all of us this past year. It's easy to say that based on how well you guys performed here and what a robust training experience we have here at the Cleveland Clinic, I would expect you guys will have a bright future.
Thank you, Andrew.